Hi, I'm Joyce Harper, Professor of Reproductive Science at the Institute for Women's Health at University College London. Welcome to Season 3 of my podcast, Why Didn't Anyone Tell Me This? This season, we'll be diving into topics that explore how to achieve good health and happiness. I'll be speaking with leading experts who will provide evidence-based advice and debunk some of the many myths around our health. Additionally, I'll be having conversations with individuals who bring unique perspectives through their lived experiences. In Season 3, we'll cover a diverse range of topics, including reproductive anatomy, inspiring female icons, chronic health conditions, factors that influence our well-being, and global women's health issues. I really hope you enjoy Season 3 of Why Didn't Anyone Tell Me This? Welcome to the mini-series on understanding reproductive anatomy. And today we will be talking to Dr. Tasha about breasts. Dr. Tasha is a highly respected consultant oncoplastic breast surgeon at the Holly Private Hospital and also practices for the NHS in Chelmsford. Her specialisms include breast cancer surgery, breast lumps and breast pain, alongside breast reconstruction, nipple discharge and breast surgery. Dr. Tasha has an MBBS from the Royal Free Hospital School of Medicine and an M.Ed in Surgical Education from Imperial College London and a BSc and PhD from University College London. She also has an FRCS from the Royal College of Surgeons of Edinburgh. Dr. Tasha shares her expert knowledge via her My Breasts, My Health blog and podcast. She has dedicated her life to helping people navigate through breast cancer. Welcome, Tasha.
Thank you. Thank you very much for having me.
Total pleasure. Now, I always start my podcast by asking my guests why they chose their career. So why did you want to become a doctor, and specifically a doctor specialising in breasts?
Yeah, that's a very good question. My path to becoming a doctor was a little bit less, I guess, predicted. I wasn't one of those kids who wanted to become a doctor from the beginning. I know lots of people who have always wanted to become a doctor since they were little. That wasn't me. So I stumbled across being a doctor because I didn't really know what I wanted to do, to be honest with you. But what I did know that I wanted to be helpful to other people. Now that sounds like a bit of a cliche, but I guess that was quite truthful from my part. So I went to medical school and graduated, and then didn't really know still what I wanted to do in terms of specialization. So as you know, you can either go down the medicine route or the surgical route or the obs and gynae route. I like both medicine and surgery, but I guess what really appealed to me about surgery was the fact that I thought at the time when somebody can come to us as surgeons and they have a visual problem that isn't quite right. So, broken bone, a lump that shouldn't be there, some form of defect, like a ruptured something. And they come to a surgeon and we can fix them, and then they leave with that problem fixed. So I thought, well, I think I'm pretty good with my hands, and I thought, yeah, let's do surgery. Surgery sounds like a pretty good speciality to go into. So it challenges you not only from the cerebral part, obviously the thinking part, but it also challenges you from the skills part. So that's what that was attracted me to surgery. And breast surgery, I thought, was a very good mix of surgical side, but also the medical side. So there's a lot of oncology involved in breast surgery. So that's what attracted me to do that. And so that's why I'm a breast surgeon now.
Fantastic. And we're very happy. And we'll talk a bit about oncology later on. But let's start with some basic anatomy. So can you explain the structure of the breast? And I think probably we know the primary function, but tell us a little bit more about the function of the breasts.
Yeah, sure. So the breast itself consists of many types of tissue. So consists of lobules, ducts, fatty and glandular tissue. And it sits on your chest wall muscle, your pectoralis major muscle. and it extends from your second to your sixth costal cartilage. So quite just below your clavicle, all the way down to your sixth costal cartilage, and then it extends from the outer aspect of your chest bone, so your sternum, all the way to the outer part, so what we call the mid-axillary line. And obviously, the function is for lactation, but breastfeeding, but also it has a role for sexual pleasure. So, and that's both for men and women. So, yeah, the anatomy of the breast is not too complicated, but it does have, certain bits and pieces that lends itself to its function.
So I'm glad you mentioned men as well, men's pleasure. So a question I get asked quite a lot. What? Sorry, I'm going to sneeze. Why do it's gone? It's gone. It's gone. And I hope that I know the right answer, but I want to hear what you're going to say. Why do men have nipples?
Yeah, that's an interesting question. Well, I mean, in the early stages of development, all embryos kind of follow a similar blueprint, as you know. And the breast and nipples start to develop really before the sex chromosomes are defined. So that's about the sixth, seventh week of pregnancy, I think. But once the sex is determined, whether you're male or female, then the breast starts to develop. And if you're assigned a male, then it kind of regresses, but the nipple remains. But obviously, between men and women, the substance of the breast, between male and females, the substance of the breast is much less, but the nipple is still there. And yes, it doesn't function as an organ to use for breastfeeding, but as I mentioned earlier, it does have a function for kind of as an erogenous zone in men. So that's why they have nipples.
Fantastic. I did know the right answer. That's the answer I always said.
Hooray! I
It's
was
a good
worried that
start.
I was going to give you the wrong answer.
No, we agree. We agree. We're taking that's the right answer. And as you said, two functions. So sexual pleasure. So, for men and women, I think probably everyone would know this. They are, as you say, a wonderful erogenous zone.
Absolutely, yeah, definitely, and it's and it's something that is important to be preserved. So definitely, that's one of its functions.
Now, let's talk about its second function. So, breastfeeding. So, I don't know what you want to say about breastfeeding. The main question I wanted to know was your views about breastfeeding in today's society, but maybe start by telling us a little bit more about how breastfeeding works.
Yeah, I mean, I think breastfeeding, I think, is becoming less common in today's society. Now, obviously, there are cultural differences globally, but I think in general, I think certainly in the West, there are fewer numbers of people who are breastfeeding, and I think there are a number of reasons for this. It's multifactorial, multifaceted. Things like lack of access to breastfeeding spaces. Maybe women are feeling more embarrassed to do that in public if they're not at home. Sometimes they are unable to breastfeed. The babies may not want to latch on, so they have problems with that. But also, modern living, people may have other responsibilities. So work responsibilities, they might have other children to look after. They might be caring for other people, parents, partners. So I think less and less people are breastfeeding. And of course, there is, I guess, a drive from companies to promote their products. So saying that, you can get formula and it's more convenient and so forth. So I think generally less people are breastfeeding.
How do you feel about that?
I mean, I think, it's difficult, isn't it? Because it's a personal preference. And there are, of course, many benefits to be able to breastfeed. And I guess, yeah, we live in a different world now. I think maybe 50, 60, 70 years ago, modern life was very different to what it is now. So, and I guess, yeah, perhaps we need to be more aware of enabling those who want to breastfeed, in public spaces, in work spaces, to be able to do that and make it less of a social taboo. And, it's probably something we ought to be talking about more as well.
Yeah, and there's varying responses about women breastfeeding in public. I, I'm always a bit, if someone tells me not to do something, I probably will go and do it. So I did even breastfeed. I breastfed on the train quite a bit, but I also breastfed on the tube. And
Right.
I didn't get very good response from, I didn't
No.
get anything verbal, but I was just sort of making a step. I also breastfed during my tutorials with my students and during meetings.
Wow. That's amazing.
But it's hard. It is hard in today's
Yeah.
society to do that. It wasn't. I didn't feel comfortable doing that. So yeah.
Yeah.
So how does the breastfeeding work and the milk and what stimulates all of this? Because that's a really interesting concept of how that all works.
Yeah. I mean, it's all kind of hormonally driven. And, whilst you, during pregnancy, your breasts are kind of being prepared for that function. So the hormonal changes will increase the degree of lobules and the glandular tissue, and just making the body prepare for breastfeeding. So, for those who have been pregnant, the breast changes quite a bit. It becomes more, the volume increases. The areola might enlarge. It changes in color sometimes. Becomes quite heavy, and it's on when you're feeling your breast whilst you're pregnant, it feels very, very different to when if you were not pregnant, or even after pregnancy, and so the pregnancy kind of prepares you for it, and then whilst after giving birth, then the kind of act of latching by the baby kind of stimulates hormones and stimulates their milk production. So and it's it's something that many women go through and have really good experiences, and some women can't breastfeed for whatever reason. And I know women who breastfeed for a couple of years, and others who can only breastfeed for 3 weeks. So it really does depend on the individual.
I personally did find it really hard, especially from probably my first pregnancy, and then I had twins, and luckily the second time around it seemed much easier. But for me, the best
Right.
thing, I'd say with my first baby, it was the hardest part of that pregnancy. The delivery was fine, the pregnancy was okay, but breastfeeding I was tough at the beginning. But I think for me, just seeing that little contented face when they sort of nod off, they almost look,
Yeah.
like they've been sedated.
Yeah. I'm
Yeah.
full. Thank you very much. Now I'm going to go to sleep. Yeah.
Just for about half an hour. um,
Yeah.
I do have a controversial question, which I'd really like to hear your views on. So, um, they, I've heard that with giving males or trans women some hormones, they're able to lactate. And what's always worried me is that safe? What's getting into the milk, and what's your view on that?
um, yeah, I don't know very much about it, to be honest with you, but it is something that obviously, many people are doing. I'm not sure how sustainable it is. I'm not sure, whether it's something that is easily achieved, I guess. So yeah, I guess it's something that we need to study more and learn more about, to be honest.
Right, enough about breastfeeding. Let's move on to let's move on to how our breasts look. So we've all got
Mm.
different sizes, shapes. Men and women all have different size and shapes breasts, and they vary so hugely. Do we know why this is? Is it genetic, environmental? Why have some of us got big breasts and some have got small breasts?
I think it's a combination of genetics and just how your body habitus is, and yeah, your weight, what your weight is like. But I think genetics does play a big part in what your breasts look like, and how big they become. So it's I suspect it's somewhat predetermined, and obviously also your body habitus and how much you weigh, how much muscle mass you have. All of those will, I would suggest, contribute to the shape and the volume of the breast.
And during our menstrual cycle, I've heard so many of my friends say they have really painful breasts at certain times. So during our menstrual cycle, how are those breasts changing from day one of our cycle till our next period?
Yeah, so the menstrual cycle kind of causes changes in hormonal fluctuations, and it's obviously not that uncommon to get a little bit of tenderness before you start your period. Now, having said that, people can get breast pain at any point of their cycle, in a way. So we categorize breast pain as either cyclical or non-cyclical. And the fluctuation in hormones can increase the sensitivity of the breast, causing discomfort. So if it's cyclical breast pain, usually it's worse before your period starts. Then the period starts, it kind of eases off, and then it gets better, once your period ends. Whereas non-cyclical or acyclical breast pain, women can get at any point, and it's something that is extremely common. I see women with breast pain all the time. I see them in my clinics all the time, and there are some things that obviously, if it persists and it's worrying, then get it checked out. But if it's hormonally related, then there are some things that you can do to alleviate the symptoms, but you can't necessarily prevent them from happening.
So if a woman's feeling that it's really pain that's affecting her quality of life, then she should go and get some checks done. Is that right?
Yeah, I mean, breast pain, as I said, is extremely common. But if it persists, then somebody's worried about their symptoms, then they ought to get it checked out.
Excellent. And let's think about the changes then from puberty to post-menopause. Do our breasts change? What's happening there?
Yeah, so during puberty, obviously, the breast starts to grow, and for lots of young girls, it can be quite either slightly awkward,
Yep.
perhaps a bit traumatizing, and some, welcome that. But yeah, the breast will grow. Fat deposition starts increasing, the volume of the breast, and shape of the breast, and the milk ducts and the lobules start to develop. So that's kind of what happens during puberty, and then obviously it changes throughout your reproductive years, as we've mentioned, or what happens around your menstrual cycle. And then around the perimenopausal, postmenopausal years, obviously the breast changes again. So the glandular aspects of the breast starts to kind of regress, and the fatty aspects start to predominate. And as we know, it kind of leads to reduction in elasticity and the reduction in volume, and that kind of progresses throughout the years in the postmenopausal years. So yeah, the breast definitely changes between throughout our lives, from puberty all the way to postmenopause.
I was one of those girls, unfortunately. I myself and another friend, both in the same year. So we were in equivalent to year five now. So we were about
Yeah.
8, 9, and got breasts. And to the great hilarity of the boys, giving us lots of grief about these appendages that had appeared, and then feeling sad for some of my friends who were much later and almost had breast
Mm,
envy. But me and the other girl, we
right.
really didn't want them. It's like, no,
Yeah.
not yet. Yeah, it's a
Yeah.
tricky one for girls. Um,
It is tricky,
It's
definitely.
it is really true. I think puberty is, there's so many things that go on at puberty. It's actually
Yeah.
growing our breasts is the least of our worries. Um, let's talk about bras. Now I know there's so many myths about bras. So what would you like to tell women about bras and some of the myths around wearing a bra?
Yeah, so bras is a funny one because it's quite funny in terms of the myths that you hear about bras. So one of them is, wearing an underwire bra causes breast cancer,
Yeah,
which is untrue. I think this started, I don't know, many decades ago, where I think it stemmed from the idea that the underwire stems kind of lymphatic flow that increases the risk of breast cancer. So that is untrue. And the recent one that I heard was, you shouldn't wear bras at night because that increases the risk of breast cancer. Again, that's not true. So yeah, bras are kind of an odd one, but I think we all need to get a good bra fitting. Many of us don't get that. Many of us, I don't know, go to the laundry department, go along the racks, and then pick up a few, put them on. Yeah, they'll do. That'll that kind of fits, and then walk out. But I think the truth is, a lot of us are not wearing the right bra. So my suggestion would be to go and make an appointment to get a bra fitting. That would be really helpful.
and what about now as we get older, you talked about postmenopause and perimenopause. So for most women, their breasts will start sagging, and that those pert breasts we had when we were younger are no longer there. Is it true that if you always wear a bra, this won't happen, or what's the truth around that?
I mean, I think it's as I mentioned earlier. As we get older, the elasticity of the breast just kind of reduces. Now, I'm not sure by just wearing a bra constantly that will minimize the reduction in elasticity. That's, I guess, debatable. But I think yeah, I don't know of any studies that has looked into whether wearing a bra in the postmenopausal setting reduces the amount of droop one gets with age, with time. I guess I don't know. Maybe that's a study we could do, but um, I think it probably is best. It provides good support, which is good. And obviously, if you don't wear a bra, you're gonna be trying to fight gravity, and you're not gonna win. So that might, I guess, you know, uh, accelerate the droopiness a bit more, perhaps. But yeah, wearing a good supportive bra, all good, all good points, I think.
Well, I must admit, and I have admitted this before on this podcast, that I hate wearing a bra and I hate wearing tights. So I think I'm not sure. I don't think I've recorded any of these podcasts wearing a bra. I'm not. I just and I have been to the brilliant fitting places, and I've been fitted. There was one bra I bought last year. It was £120 from a really good shop,
Oh my
and
goodness.
I cannot stand it. I
Yeah,
really. And it's definitely got worse as I've got older. I've become really intolerant to anything tight or fitting. I
yeah,
always wear big baggy dresses, and as I said, don't wear tights. So I'm really minimal. And so for me personally, I'm really glad that we work at home more. But I do sometimes walk around Tesco's with no bra on and hope I don't meet anybody because they're not where
now
they
the
were.
now the truth is out.
No, it's been that I've admitted this, and I don't know. I mean, I could spend ages talking about it, but yeah. So, and I've heard a lot of women. You see lots of memes and things saying first thing they do when they get home, take the bra off. So yeah, but
Yeah,
what
yeah,
everyone needs to do what feels right for them. But let's
yeah, exactly.
yeah
I mean, lots of people don't like wearing bras, right? And I think probably 9 times, if not 10 times out of 10, what women do first thing when they go through the door is take their bras off, because it's it's kind of it's freeing, isn't it? It's liberating. But and I think that's fine. If it's more comfortable for you, that's absolutely fine. It's only when you get kind of the discomfort and the niggling pain, then sometimes actually wearing a bra can actually help with that. But whatever works, right? Whatever works for you. If you feel you're better loosey goosey, then that's fine too.
Yeah, mine are free as a bird. Now, one more thing about bras. So, sports bras. So, I did talk about sports bras with Baz from the Well HQ last year, and she talked about how really important. And I know there have been studies looking at women running and how their breasts move and doing other kinds of exercise. So, what's your advice about a sports bra?
Yeah, I mean, I guess, chime what was said, in that sports bras are very important. If you do any kind of sports, really, getting a sports bra is really, really useful and really helpful, because you want your breast to be supportive and not moving around not moving around much. But you can just imagine, if you're, say, generously breasted and you're not wearing a supportive bra and you're going for a run, you just can imagine what the breasts are going to be doing, right? So definitely get a good supportive bra, especially if you're for sports, definitely.
And the other thing Baz was saying was that change them quite regularly, because I noticed today I was doing body attack, which is very jumpy and lots of star jumps. And I wore a bra that that used to be really tight, and I've realised it's been getting a lot easier to get on, and it seems more comfortable. But then today I realised, as a result, it's not supporting me enough, and my breasts were all over the
Yeah.
place. So yeah, that wasn't a good look. So I
Yeah.
think that might be the last time I wear that bra. So yeah, get regulated. Sports bras do have a lifetime. So yeah, get
A
them
lot, yeah,
changed.
because the elasticity runs down, doesn't it? And the more
Yeah.
washes you do, and there's certain ways you need to wash a bra, and I don't think bras aren't supposed to last forever. So, and your weight changes as well. You might gain weight, you might lose weight. So, getting a kind of a regular bra fitting is quite helpful.
Yeah, I think I have lost a bit of weight because I've not been eating sugar, and I think that's the problem. I did know, as I said, I noticed when I went before I got to the gym that it's feeling really comfortable, and then I was like, oh my god, yeah. So yeah, keep them supported, ladies. They shouldn't be jumping up and down.
Definitely,
Now,
definitely not. Yeah.
you mentioned about pain, so let's talk
Mhm.
what else can go wrong with the breasts and the most common conditions that women can have.
Yeah, I mean, there are lots. There's a plethora of things that can develop in the breast. And obviously there are benign things, i.e. non-cancerous things, and there are obviously cancer. So there's cancer. So the benign conditions, you can have things like cysts, fibroadenomas. Uh, those things are non-cancerous, but then of course you can develop cancer. And pain is obviously another thing that many women experience.
Yeah, and how important is it for women to keep a check of their breasts and look for warning signs?
Yeah, I think it's very important to be breast aware. The recommendation is to examine your breasts, once a month. I mean, it doesn't have to be like on the dot every month, but regularly is the take home message. So breast examination is important, and also if you're over 50 and over, in the UK at least, you would be invited to attend the breast screening program, and you would be offered a mammogram once a year. Sorry, a mammogram every 3 years. So, so definitely, if you're over 50 in the UK, make sure you're enrolled in the NHS breast screening program.
Now, I've gone for every mammogram. We have a mobile unit that comes to our supermarket just very close to where I live, and I've always gone. But there
Mm-hmm.
was, I think it was a paper out a couple of weeks ago that was saying that the data is saying that mammograms don't make any difference. Is that true? I can't believe it, really.
Well, I mean, mammograms. The aim of mammograms is to detect cancer early, and it doesn't obviously prevent cancer. So a mammogram is a snapshot of what your breast is like that day, and that's why it's important to be breast aware, because if you're having a mammogram, say once every 3 years, your breast is going to be changing within that time. And similarly, having regular checkups will mean that anything that's new, that is unusual, would be picked up. So, I mean, certainly the guidelines at the moment is still that screening is offered to those over 50, whilst being breast aware is very important as well.
And when women are doing their breast examinations, is there somewhere they can go to get the right information about? Because I know things change, so about how they should do that. And you said once a month. Is there any? They used to say a particular time of your menstrual cycle if you're having a menstrual cycle. Um, what's
Yeah.
yeah?
I mean, if you're premenopausal, you do it kind of after your period ends. So that's, don't do it before, because obviously that's when your breast is quite, it's quite active and might be tender. So do it after your period ends. If you're postmenopausal, you can just pick a time during the month when it's convenient to you. And there are kind of, examine your breast with the flat of your hand. Don't forget to examine your armpit as well. Usually opposite hand, opposite breast. It doesn't really matter how you do it, as long as you examine the entirety of the breast, not forgetting the central aspect of the breast, so, the nipple area as well, and then examine your armpit as well, and do obviously both sides. I actually have a YouTube channel. It's called Dr. Tasha, and if you go onto that channel, there is a guide to how to examine your breast. But you can go there, but there are other resources out there. Breast Cancer Now, I'm sure, I know will have information about how to do a breast exam. But it's not rocket science. I think we think that it's something really complicated, and it's I need to kind of read it somewhere to tell me exactly the steps I need to do and follow. It isn't really. Literally just examine your breast with your hand, and if there is something that isn't right, then you should be able to, hopefully you should be able to pick it up.
Great advice. And I'll put the link to your YouTube channel in the show notes as well, so people can get straight there. But that's brilliant. You've done that, so it's great. Now let's talk about cancer. So breast cancer. So I've interviewed Liz O'Royden, wonderful Liz, on my podcast. I think actually the first year of the podcast. We're in year 3 now. So Tasha, can you tell us more about breast cancer? How common it is, the treatments, and the prognosis?
So yeah, breast cancer. 1 in 7 women will develop breast cancer in their lifetime. In the UK, that equates to about 55,000 women a year are diagnosed in the UK. And men can get breast cancer too. So about 500, just under 500 men are diagnosed with breast cancer each year. And with modern medicine and modern techniques, modern drugs, survival is it has improved over the years. Over, I would say, around 80% will survive the disease. And there are different kinds of breast cancer, right? So, but overall, you can divide breast cancer into invasive cancer and non-invasive cancer. So the invasive cancer are the cancers that can, by its definition, invade other parts of the body. And the commonest invasive cancer in the breast is invasive ductal carcinoma, and the second commonest is invasive lobular carcinoma. So those are the 2 common types. And there are other invasive types of breast cancer, but those are the 2 common types. And then you go, and there's the non-invasive breast cancer. So that's what we call DCIS normally, ductal carcinoma in situ. And those are the cancers that we detect on screening mammograms a lot of the time. Although DCIS can live side by side with invasive cancer at the time of diagnosis. In terms of treatment, it's multimodality treatment is usually what is offered, and it is individualized according to the patient's cancer. So it can involve surgery, chemotherapy, radiotherapy, immunotherapy, endocrine treatment, and it depends on that person's cancer. And so I always say to my patients, please do not compare your cancer to somebody else's cancer, because firstly, you don't know what cancer they might have had, and also the type of the cancer, and so their treatment might be very, very different. So you can't really compare treatments. So so that's kind of a general overall picture of cancer.
Yeah, it's great news that the prognosis is so improved. So I know if women do find something on their self-examination that they obviously are going to worry. I've had benign breast lumps before that have been tested, so it is a worry. But please just go and see your doctor as soon as you can, because the outlook is really good. And I think for some the treatments are quite harsh, but the outlook's good. So just get down to your doctor if you. Now,
Definitely. I mean, sorry, just want to say something about prognosis, I guess, survival. Although whilst the majority of people do survive the disease, unfortunately, not everybody's cured of this disease. And, about 12,000 deaths per year is attributed to breast cancer. And that's about 32 deaths per day. So,
wow.
32 deaths per day from breast cancer, that's a lot. So, we still need to do a lot of research. We need to, to raise awareness and things to make sure that, as you mentioned earlier, be breast aware. And, if you have any concerns, please get it checked out.
Is there an age when it's more prevalent? Can it happen at any age, or is it more likely over 30 or over 40 or over 50?
Yeah, I mean, the risk increases with age. It does cover the spectrum of ages. You can get breast cancer, in your 20s, 30s, but the incidence is lower. The risk is lower. The risk increases as we age. So, of all those cancers that are diagnosed in the UK, from that number, about 80% are over 50.
Wow.
So, it increases with age. The older you are, the greater the risk.
So it's important for everybody to check their breasts, but really for those over 50, we really need to do that. And I must admit, I haven't been doing it as often as I should. So you've made me go, I'm going to go do it in a minute. Not now. But when we finish, I'll go now, I've heard Liz talk about this, but I wanted to talk about lifestyle. So our diet, exercise, etc., affecting breast health, but also breast cancer. So how does lifestyle affect our breasts?
Yeah, lifestyle has so many effects on so many levels for so many, it determines so many aspects of health, right? But for breast cancer, definitely, there are things that we can't change. So the two biggest risks for breast cancer is getting older and being a woman. So we can't change those things. But there are certain lifestyles or modifiable things that we can change. So alcohol, to limit alcohol intake. That is that's something that we can do. The advice is limited to about 14 units per week. And if you've had breast cancer, that certainly should be reduced to about, I think, 5 units per week. Obviously, kind of maintaining a steady weight. So, and maintaining a steady weight can be, either diet and exercise. Maintaining a steady weight also reduces that risk of developing breast cancer. Exercise is extremely important, especially for those who actually have had breast cancer. We know that exercise reduces the recurrence risk, by about 40%. So I always tell my patients, please, after you've finished your breast cancer treatment, do some exercise. If you haven't done exercise before, start. And if you have been exercises before, then try to get back to your level or increase it even. So, these are things that, not rocket science, right? I mean, we talk about this a lot in terms of just health in general, the other thing is obviously sleep, and sleep is just part and parcel of being healthy and all that good stuff. So, yeah, if we can do our bit, that would be really helpful.
Thank you. I'm glad everyone says the same thing about, no matter what topic we're talking about, our lifestyle is so important, and it really is in our hands. And I think as we get older, we're much more aware of it. But the sooner we look after our lifestyle, I always say it's the best preventative medicine. So, really, really think about that. When you're having that glass of wine, think about all the things that you could be doing that are negative to your health, for sure.
Yeah.
Not what people want to hear, but it's the truth. It's the truth. Right. I wanted to ask now a bit about breast surgery. So breast surgery, especially for cosmetic reasons. So certainly when I was younger, the breast implants was a huge thing. I have the feeling, but I don't know if it's true, that it's decreased over the years. It seems now that it seems to be a fashion with younger women not to have the big breasts anymore, but to have the big butt instead. So now they're sticking all sorts of things in people's bums. But what's your view about cosmetic surgery?
Yeah, I mean, I think it's difficult to I guess to definitively say which way it's going, but I think actually it's increasing.
Oh,
I think, I think I think the cosmetic world trying to achieve that perfect look, whatever that perfect look is, especially with the advent of social media. I think breast implants, breast augmentation is increasing, and certainly where I am, I do see many women with breast implants. And yeah, as you said, the Brazilian butt, I guess, is the augmentation of the bum, and all sorts of things. So I think it is increasing, and it's something that people do cosmetic surgery for individual reasons, right? It's there are obviously risks pertaining to cosmetic surgery. Implants, for example, don't last forever, and at some point they will need to be changed and removed because they will rupture at some point. And these are things that I think many people either don't want to think about or weren't told about. But yeah, I think cosmetic surgery is on the rise.
now you started this podcast saying that the function of the breast is for sensation and arousal and breastfeeding. So if you have breast surgery, what happens to those two functions?
It depends on the surgery that you have. If you obviously, one of the other cosmetic things that people can have, a surgery people can have, is a breast reduction. Now, although I think breast reduction has health benefits, if you're generously breasted and you're quite small, you're getting back pain and neck pain, then that is quite helpful. So it does depend on the surgery that you have. If you can have breast implants, and if you want to breastfeed, that doesn't necessarily stop you from breastfeeding. And similarly, the purpose of the nipple areolar complex can still work. It depends on the surgery whether the nipple areolar complex was disrupted. That might have an effect on the sexual function of that area. So yeah, it does depend, but people can still breastfeed with implants.
Oh, thank you. I thought for most people they couldn't, so that's really good to know. So, but yeah, be careful what you do with your nipples. um,
Yes.
um, are there any other common myths or misconceptions about breast health that we haven't talked about already that you'd like to address?
Things like, there are quite a few actually. Things like mobile phones can cause breast cancer. That's not true. Eating soy, soy has kind of phytoestrogens, and that people think that increases the risk of breast cancer. That's not true. Trauma, so if you've knocked your breast, then that can somehow trigger something to cause breast cancer. That's not true. I think a lot of people, well, not a lot, but some people might have knocked themselves, and then they examine their breasts because of that incident, and then they find something, and that prompted them to come to see a surgeon. That thing probably was there already. The trauma was the trigger for the person to find it rather than the cause of the cancer. So yeah, that's a myth. Other things, if many people think that if their mother had breast cancer, then you'll get it too. And interestingly, people think that, oh, I don't have any family history, therefore I can't have breast cancer. So the genetic kind of component of breast cancer, or the majority of breast cancer is sporadic. It just happens. Only 5 to 10% are genetically linked. So, and when I mention that to people, they're quite surprised by that, because I think people think if you don't have a family history, you can't get it, and vice versa. So yeah, so that's another thing that I hear quite a lot.
I can remember when I first heard about the breast cancer gene, the BRCA gene, and we really were so excited, and we thought this is going to explain. We knew it wouldn't explain all of the cases, but we thought it was going to be like 80%. And then to hear that it's 5 to 10% has been, and that was a long time ago. It's been a bit depressing to not find more reasons why some people get it and some people don't, for sure.
Yeah, definitely. I think it's multifactorial. Now, obviously, if there is the BRCA, if there is a history of somebody carrying the BRCA gene mutation, then you get tested, and if you have that mutation, then yes, your risk increases by 60-70%, and then there will be things that we can do to minimize your risk of getting breast cancer. But unless you have the mutation, then just because you have a family history doesn't mean you get it.
Yeah.
Necessarily. Yeah.
Now, Tasha, I called this podcast "Why Didn't Anyone Tell Me This?" because we were talking before we came on about the lack of education, and we're not often taught these things at school. So I don't know if anyone has a lesson at school about their breasts. Please let me know, and I'll go and shake their teacher's hand for sure. But have you heard? You've talked about many things today. So what's the most common thing that people didn't know that you told them and they said, "I didn't know that"?
Yeah, I think it would kind of pertain to the myths that I've mentioned. Things like, oh, I didn't know men can get breast cancer. That's something that I actually recently heard from somebody, and that's like, oh wow, I didn't know. I just assume only women get breast cancer. So that's one thing. Again, as I said, the genetic link, the underwired bras. I've thought that wearing an underwire bra will cause breast cancer, therefore I don't wear an underwire bra. So usually it's related to the myths that I hear people say, and I do dispel quite a lot of them quite often.
I have moaned about this quite a lot, that people like you and me, we spend too much of our time having to debunk myths that come from all sorts of places. But as you've said a few times, so social media really doesn't help at all. So yeah, thanks for debunking those.
Oh,
Now,
definitely. And I think that's the reason why, you and I kind of do this, right? So
yes,
we need to, we kind of want to kind of claim a little bit of space to be able to hopefully be able to give correct, robust, accurate information.
absolutely. Now, Tasha, my final questions to my guests, just to always end on a happy note. So, Tasha, what makes you happy, and where is your happy place?
Yeah, I was thinking about this. I don't know the answer to like definitively, because what makes me happy, there's many things that make me happy, and I actually I find the little things in life make me happy. So I'm a very simple person. but genuinely, like you wake up and it's a nice sunny day, or, a nice cup of coffee in the morning, knowing my family, family's healthy, things like that, make me happy generally. So many things make me happy, and that's one of them, many of them rather. My happy place, again, it varies. I like water, and I guess I like swimming. So I do like being in water, and currently I'm kind of swimming quite a bit. So the pool currently at this moment in time is making me happy, very happy. So yeah.
Lovely. Water is, I think, the most common. If someone talks about sort of
Oh, really?
environment, yeah, water is. But I was having dinner with someone on Saturday and one of my friends said, "I hate water. I hate being near water. I hate being in water." We're all different, which is great.
Yeah, we're all different. I mean, I think like I guess nature makes is a happy place for me. Like when I go skiing, I just love the mountains, and that's at that time that is absolutely my happy place. So I guess nature is my happy place.
Yeah, those skis. This bring you on a ski slope. It's so stunningly beautiful.
Right?
Absolutely.
How can you not be happy there?
Yeah, for sure, for sure. Now, the very last question: what advice would you give your younger self?
I would say, there are many things I would tell my younger self, but I guess one of them would be continue and follow your own path, and don't let other people tell you otherwise.
That's very beautiful. I love that. Well, Tasha, it's been absolutely fabulous. I am going to go off now while this is uploading and check my breast. So please, everyone, don't forget once a month. And Tasha, thank you for being an absolutely wonderful source of brilliant information about these wonderful structures, our breasts. Thank you.
Oh, it's an absolute pleasure. Thank you so much for having me. It's been a delight having this conversation with you, and I hope your audience found it helpful. Thank you so much.
Thank you. And did I hear a little cat in the background a few times at the beginning?
You did. I am so sorry.
No, I love it. I
She's
love it.
asleep, but yeah, she was.
I have mine in the background
Yeah, I'm so
when I'm doing
sorry.
a podcast, but normally a couple of times, actually not when I've been doing a podcast, but some meetings, they do bring in a mouse, sometimes alive. So, but no, she sounded very cute.
Lovely.
So,
Yes, I do apologize, but yeah, she was behind me. She's behind me still. So yeah.
no, well, I just wanted to make that note on the end before we sign off. So thanks again, Tash. Thank you.
No worries. Take care. Bye bye.